I am Talibita Moses. I am a lawyer and a patients' rights campaigner, and I work with Uganda National Health Consumers Organization. And I am going to make a presentation on public advocacy for patients' rights in Uganda, what promoting the Patients' Charter and enabling law campaigns yield. I am here to showcase what is it that we do as an organization for purposes of trying to encourage whoever is listening to adopt the same, because this, of course, is where we need to go, all of us. I want to start on a very critical aspect, because every one of us will appreciate that health is for the client. Much as I want to get a disclaimer, and I want to uh, quote the famous words of Professor Omaswa, which says that health is made at home, and when it breaks down, then it is taken into the hospital or into the health system for repair. So I am going to start with what are the challenges that are failing the patient being at the center of care. I know, and I hope every one of you will agree with me, that if there is no patient, then there is no health facility. And the private sector needs to appreciate that a patient needs to be considered or looked at as a client, because as uh, Gandhi said, that a customer is king, and to the health facility, especially the health sector, the patient is indeed the client. And if, with of course the liberalization of the private sector, the patient, or the mushrooming or proliferation of very many health facilities, the patient will always look elsewhere, especially if that particular patient is empowered. And believe you me, the health sector needs to know that the patient's rights movement is a bushfire, and it's not about to go, it is here to stay. So when we look at Uganda, just like any other countries, we are still using the docious, or the law of torts, and we are looking at medical negligence, and that legal framework has still subsists. Now, the biggest question is, what is the prosecution success rate for any violations? It's very minimal. The other aspect is the patient still at the center of care when every other time the health workers' welfare and wicked health systems have turned current? Next, after next, there is industrial action, and of course, the health workers have really held government at ransom. In the Ugandan case, the health workers have been allowed to operate facilities that are competing with the time that they are supposed to provide. And I want to quote the classical case of the pharmaceutical society. A, pro, a pharmacist can have a license for about 10 facilities that is never known pharmacies. And the other aspect is on health financing from the national budget. It is not anchored on the aspirations of the rights-based approach. And in the Ugandan case, for over 20 years, they're still talking about national health insurance. And it seems now to be an escape route for government that has failed to comply with the Abuja declaration that requested government to commit 15% of their national budget to the health sector. And financial challenges have become a problem. And that is what explains the drug stockouts, expiry of drugs, and the dwindling human resources for health, and also the shrinking essential medicine lists. have become a real occurrence of every other day. The other aspect which challenges placing the patient at the center of care is the health sector is clinicalized. The ambulatory system, the blood transfusion, dentistry, optics have turned into amenities, and you know what? They are only concentrated in the urban centers. So the patient who is at the peripheral, who is at the far end, is still struggling with accessibility, with economic aspects. And all this is that they cannot afford the care, which has, of course, become very expensive. And even for what government has subsidized for, it has been tagged on the price. Now, having, of course, looked at the failure of making the patient at the center of care, I want to delve into one of the very thorny and motivating factor for us vouching for a patient's rights bill, and that is detecting or knowing that a patient is under detention. Of course, this is as a result of private sector that has highly priced itself, the health workforce that has, in a way, been sent to blackmail government that they need a lot of money, or they need preferential treatment, or that government actually needs to look at them over and above the other civil service, and they have chosen to go for greener pastures, or they have decided to go moonlighting even when they are still civil servants. Now, there is when when you look at the health spaces where these particular health workers are supposed to work, they have they have really been turned into private. The free services or subsidized without notice have turned priced. And this, of course, speaks to the recent, on the 6th of, on the 6th of October 2019, specifically the president of Uganda gave a presidential directive to close forthwith all pharmacies that are running in government hospitals. These particular facilities have been seen to be vehicles of extortion, have been seen to be vehicles of trying to steal government medicines, but also have been seen to be vehicles of trying to sell medicine or prescribe it on the basis of branding. And here, what government brings has been left to expire. And then again, uh, patients will know that they are or shall detect that they have been detained when all of a sudden they see an astronomical medical bill after having received the service. The lawyers will tell you that in the law of contract, past consideration is no consideration. This means that if you did not negotiate to enter into a contract, then whatever comes as a result is what you settle for, which is more or less like a gentleman's agreement. So you have no way out but only to pay. The other aspect that confirms that you are detained is when the health worker decodes the prescription or writes it in the way that it is not legible. Yes, even for those that we call uh, the expert clients, they can't suspect. And that, of course, is another case or classical case that confirms that you have really been detained, because that doesn't give you the freedom of choice to choose wherever you are, and you're still stuck within their web. And you know what they are saying? Come into our parlor, Mr. Housefly. Now, the other one is the undue influence to obtain services from a place not of choice. So the government doctor will charge for death, or rather, I want to give an example of a government doctor who was charged for the death of an expectant mother who he referred to his own facility. Now, in the Uganda circumstances, government facilities are well equipped, they have the best expertise, and perhaps the equipment. But this has been demonized by health workers who really want to make more money from their health facilities that are just adjacent or trying to seek revenge on the government facilities. So this particular doctor in Mukono was sued, rather was sued for having caused the death of an expectant mother who was pronounced dead on arrival in his facility. This particular doctor was acquitted for want of evidence because there was no evidence, and police, of course, most of these cases have not attracted the attention of the criminal prosecution success because either there's nobody following up or the police are not interested because they look at this as clean collar. The other is a patient is not discharged but is no longer on medicine, and you really wonder why they would keep them in the facility. Then the other one is the physical detention of human beings or dead bodies who get confined for failure of paying medical bills. Now, the other ones are withheld because the diagnostic results are not given to the person who has paid. Now, you really wonder, if I have paid for testing my medicine, I have tested my blood, how come you don't give me the results? And this is very rampant because the Ministry of Health says that about 70% of the health services that are sought in government hospitals are actually laboratory services. So now, I want to give you an example of a very wealthy a very healthy patient who was confined because he was incapable of, he was bedridden, and then he wasn't receiving any better treatment at the facility he was, and so he thought he could be referred, but he had not paid the money, and his money was on his bank account. And you know that the banks are also protecting the client. There is the bank client relationship where they could not allow any other person to sign. So a son of the patient went to the bank and told them, even showed them photos that his father could not actually access the bank. The bank refused to issue money, and the hospital refused to discharge the patient. And behold, patients' rights activists and even the public was stunned when they saw a patient who was uh, taken on an ambulance, not to a hospital, but to a bank just to sign and get money so that he can be referred. And this, believe you me, did not rub us the best way. Now, what does promoting the patient's charter or enabling campaigns yield for us? Our request to government or to those that hold power and those that are listening to me is that one, we need a constitutional inclusion of the right to health, which makes health goods and services a claimable and justiciable right. Claimable in the sense that citizens can claim because those rights are given to them, can claim health goods and services that are of quality, and if the event they are denied those particular services, the citizens can go to court and seek, among all the other remedies, compensation. So that will empower citizens, and but that also will become an accountability tool. But then again, citizens will definitely have a guarantee which is well settled or well entrenched in their supreme law of the land. The other one is a patient's rights and responsibilities law, which will turn around into a patient empowerment tool that holds the rights holders accountable, and it is replete, or rather, it is full of sanctions for those that violate the rights, and also as rewards for the victims, because then it reinstates them into the state they were in before they suffered the violation. The other one is that by promoting the patient's charter and the enabling laws, in this case the constitutional inclusion of the right to health and the patient's rights and responsibilities as a bill, as a parent law which is making function of the constitutional amendment, um, that it creates a health sector that is in harmony with the patient's rights to fast-track universal health coverage. That the citizens, regardless of where they are, regardless of whether they have the money or not, they are in harmony with those that provide the service, and that they are mobilized to come and access the services that, as taxpayers, have through their government channels been provided. We have mobilized citizens to come to government facilities, but only to be frustrated that the services that they have come for are not there. And that, of course, fails the successes that government or health facilities have already registered into what we would call better health outcomes. Now, this is what, of course, we have done for purposes of popularizing the patient's charter. We have decided to come up with cartoons so that they, those that cannot access the text, because all Ugandan laws, I am afraid to say, are not in braille, they are not in voice, they are only in text and English. So, for purposes of easing campaign, but also trying to reach out to the high end patient, or rather the low end patient, we decided to reduce this, and we put all the articles of the patient's charter into paintings. No, into pictures so that they can ease. And these, of course, are replete of the rights, and then also they have responsibilities. Now, the patient's charter, I am afraid, is not a legally enforceable document, but it is practice that the health worker or the ministry is adopting. We, through a partnership that we have with the Uganda Healthcare Federation, the Uganda Healthcare Federation has membership of about 70 health facility service providers. They have accorded us platform with the patients' rights and health consumers to go and explain to them the essence of them implementing using the charter. We have told them how much through the client satisfaction study that we were funded to do uh, through the client's satisfaction studies, which enable the health facilities to attract or to turn into the best destination of choice of the health seekers or health users, especially in the private sector. Because patients actually told us that in places where a rights-based approach in the private health service providers has been, they have always recommended the other clients, or they have always felt comfortable to come, or they have been very confident that they will find the required medicine, they'll be treated as people deserving of care, and they'll be recommended, and they're not afraid that they're being cheated. They have always come. The other is we have, through building networks with the journalists, they have given us what I would call and media, because we have always been at the center of providing them with the required information, but also we have used the media to name and shame hospitals that have detained patients. And this has recorded a lot of successes, because for every case that we have been, for every case that we have received through our community-based paralegal structures, and we have had this uh, been followed up by a media house, the success has been that all these patients have been released. Now, this, I must say, we need support on providing the rehabilitation services, because yes, we have rescued these particular patients, but we have let them go. We are aware that we can also, after they have recovered, then because we are releasing them, we release them with a patient's complaint form, which requires of them to narrate what their entire audio, but also put receipts that really pin the facility. And also we have this particular patient's client form notarized or witnessed by a commissioner of oath, so that this becomes watertight evidence at some point when we are going to file up a suit, because we don't want to be seen to promote impunity. So these are the particular cases where we have, but also we have written and where we are calling on government using the mass media. Now, the Patients' Rights Bill and Responsibilities Bill is the other one where we are trying to influence, or rather call to the attention of the legislators, because the Constitution rightly charges them with the duty of making an enabling law for the peace and the development and order of Uganda. And so we have interested Parliament, and we have demanded through trying to give, through our budget advocacy, more money should be channeled to finance these very rights. But also, we are saying, because we work with the patients, every other time we work with the patients, and then we are asked, because we are very popular with the patients, and wherever we have voiced the patients' concerns, the Ministry of Health, when it has implemented them, it has registered better health outcomes. Now, we are using the Patients' Rights Bill as a negotiating bill, or a negotiating bill for us to be seen to popularize in the clientele of the health sector, or our health, or rather the people whose voices we represent, that if we are going to market national health insurance, which of course we are very much interested in, and we are also trying to show government that there are other financing mechanisms that they can use for now, because we know it for a fact that in 2015, the United Nations, through the Addis Ababa Agenda for Financing for Development, specifically said, or rather encouraged states to, as a means of increasing domestic revenue mobilization, to increase but also earmark revenue picked from tobacco products to finance universal health coverage or universal health care, or even to increase on financing for health. And then, of course, we think the better good that will come is that there is going to be a lot of welfare improvement in the health workers, but also we are alert to the fact that the president has issued a directive on the Ministry of Public Service to increase the salaries of the health workers. We know that indeed happy cows produce more milk. I say all this for God and my country. Thank you for listening. The patient's voice must be at the center of care. Thank you.